Boys, this episode's for you. Curt was concerned about his varicose veins and wanted them gone. Veins aren't just unsightly, they can also cause major health problems when not removed. Let's see what Curt decided to do on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, took and kicked them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Varicose veins can be a very unappealing look, even for blokes. I thought it was just my opinion, but when I started to ask a few of my male colleagues around the station, they also felt the same way. I knew it was time for me to look into this issue. Join me now as we head over to Dr. Nesbitt's office to learn all about varicose veins. Well, here I am at Mindful Medical to discuss with Dr. Nesbitt what actually are varicose veins. How are you, Dr. Nesbitt?
Great, Troy, and thanks for having us. You know, varicose veins are the most obvious part of peripheral venous disease, so they're the most evident, but it really represents a constellation of problems that create significant symptoms in people.
So the public think varicose veins. That's not the actual real name. You're talking more about the disease side of things.
Well, the disease that causes varicose veins is venous insufficiency, which is really you lose the valves in your veins and then you have pressure from your heart all the way down to your feet. So some individuals will get varicose veins, but the achy legs and the restless legs and swollen legs can be in individuals without any varicose veins.
So how do the varicose veins come about on the body?
Well, the varicose veins just develop over a period of time. So they'll start out small and get larger and larger as time goes on because of pressure. You lose the valves in the veins, which means you don't temporize the pressure, and without any valves in the veins, you have pressure from the heart all the way down to the foot.
Okay.
And with that high pressure, the veins gradually enlarge and become evident so that you can see them.
And that would lead me to my next question, how obesity is a major cause for varicose veins.
Oh, it definitely is. And the reason for that is it's putting a large amount of pressure on the lower part of the veins, and the increased weight over the top of that puts increased hydrostatic pressure on the veins, making the veins have a higher pressure in size, enlarge more, become more achy, cause more swelling.
So are there different types of varicose veins, and do they have the same issues and health issues for the body?
Well, the varicose veins is part of chronic venous hypertension, or the loss of the valves in the veins. So after a certain size, it's called a varicose vein. At a smaller size, it would be called a spider vein. So the small capillaries and venules with the high pressure on them will then gradually become spider veins, and a larger vein with the high pressure can become a varicose vein.
So when we say varicose veins out there every day, we think the legs. The minute you say spider veins, I think about them around the nose and on the surface of the skin for the face.
Right, and that's only because you're a male, but there's a lot of...
Well, sometimes I wonder.
Yeah, no, but there's a lot of women out there that really notice there's spider veins on their legs as well. But the spider veins on the upper part of the face is also a bit of a venous disease, but it's a little bit different than that in the lower extremities. Because the heart is below your face, you don't get the increased high pressure in the veins
got
of the face.
you. So what are some of the health issues that we see that go along with varicose veins?
Actually, the biggest one that most people aren't aware causing it is restless legs. And restless legs are because at the end of the day, your legs become swollen and achy. And as you try to go to sleep, they're aching more and you're paying more attention to it. It's really caused by the venous disease, and they have all sorts of medications that just drug you up, which is kind of tragic because you can really treat the restless legs by treating the cause of the restless legs, which is the venous hypertension. Okay,
so when you say restless legs at home, at the end of the day, you've been on your feet for 10 hours, say. Is a way to fix that by just putting your legs up, elevated, or like on a cushion or a pillow?
It definitely helps, and the reason for that is because if you've lost the valves in your veins and your achy, restless legs is being caused by high blood pressure in the veins, putting your feet up above your heart lowers the pressure. The only problem is you usually do that just as you're going to sleep, and it takes a period of time to have it resolve. And so if you think about it, a lot of people go to bed at night with swollen ankles and they wake up in the morning and their ankles are no longer swollen.
Okay.
Why? Because they laid down.
Well, they've laid down, they've elevated their legs.
Exactly.
Well, let's take a quick look at some of the common myths about varicose veins.
There are a lot of myths out there about varicose veins. The first is that they are only a cosmetic procedure. This is simply not true. Varicose veins can develop into serious issues, such as a disease called chronic vein insufficiency. I also hear that people think men are not at risk for developing varicose veins. In reality, 43% of men are expected to develop some form of venous disease by the time they reach the age of 60.
There's obviously more than one procedure to have the veins removed. Talk us through that. Explain them to us.
Yeah, there's a variety of procedures actually, but the biggest problem is the increased pressure in the veins that you can't see. And so those are resolved by using either radiofrequency or laser. And which one you use really depends on the location of the vein and which vein it is. The varicose veins themselves, the ones you see, you remove by something called a microphlebectomy procedure or foam sclerotherapy. The thing is it's not the old vein stripping that they used to do and came with a lot of complications. These procedures, we send you right back to work when you leave the office.
Which I find amazing, hence why we decided to do this particular procedure on Curt. And what was that procedure called?
Curt had a radiofrequency procedure where his deeper veins were destroyed by radiofrequency obliteration.
Okay.
And then he had a microphlebectomy removing the varicose veins.
So why did you decide on this procedure for him?
Curt had fairly large veins, and as a result of the large veins, I prefer to use radiofrequency because it seems to do a better job for the large veins.
You're saying that there's less risk nowadays doing these type of procedures?
Yes, there's a lot less risk. The old-fashioned way to do it was with general anesthetic, where you had to put the patient completely to sleep and do an old-fashioned vein stripping. And then on the sides of the veins can be some nerves and other structures, and when they would put a catheter down through the vein and literally tear out the entire vein, it had several problems. The first of which is they didn't even know for sure which vein they were in because they didn't have good ultrasounds to follow it.
Wow.
And the second one is about a third of the time they could cause some peripheral nerve damage, which was permanent. And they would be in the hospital for several days.
Yeah.
Besides the fact that it would take 6 weeks to recover and have major bruising.
So what are the risks if you don't have the varicose veins removed?
It's really a quality of life issue. Some people can get so bad it goes all the way up to the very large swollen red ankles and ulcers in their legs. But in general, the reason that you'd want to get it done is because of swollen legs, achy legs, and for me, restless legs was a big issue before I was treated.
Not everyone wants to have surgery. And you were telling me about these compression socks. How do they help medically, and what do they do?
Fundamentally, the disease is a genetic disease, and we take care of all the large veins, but you still have a lot of small veins that are a problem as well. So even when we treat a patient, we like them to wear their compression stockings. In fact, I'm wearing mine today.
Okay.
And it compresses the vein and relieves the pressure on the sidewalls of the vein, and it also gets rid of the swelling in the tissue, so you have much healthier legs. So if you're unable to get treated to solve the cause, wearing compression stockings definitely helps progression of the disease and helps the symptoms of the disease.
But it doesn't cure the disease, does it?
Unfortunately, the compression stockings cannot put the valves back in the veins.
Well, that's as simple as it is. These to help you alleviate the pain and make the veins not go any worse as such. Is that what you're basically saying?
Exactly.
Or have the operation. It's as simple as that.
And even after the operation, I think compression stockings are a good thing to have.
Okay, perfect. Coming up after the break, we'll learn why Curt was so eager to have his unsightly varicose veins removed, and Dr. Nesbitt will use radio frequency technology to blast them away. The following footage contains actual surgical procedures. It may be too graphic for some viewers. Before the break, I chatted with Dr. Nesbitt about the causes of venous insufficiency and one of the biggest symptoms, varicose veins. Let's head back to his office and watch as he treated Curt's veins.
10 years ago, I was 27 years old. I used to be a competitive bodybuilder, and I had 700 pounds on the bar. And mid-squat, both veins just popped just like that. I had valves pop in each leg. I couldn't walk for weeks. My legs were purple and yellow and black. They were so bruised from where these veins, just basically ruptured. And it was really traumatic.
What we're going to do right now is we're just going to mark those varicose veins, because when we lay you on your back, we're not going to be able to see them.
Okay. So today I'm having my varicose veins removed, and it's embarrassing. I'm a cyclist, I do triathlon, so I'm in shorts quite a lot. And they've got these ugly, just horribly ugly veins sticking out of the back of my leg. I'm quick to show the front of my body, but the back where the veins are in the back of my knee and that run along the back of my thigh, I don't want anyone to see that.
Depends on how well they come out, but you don't have to take out all of the vein. You have to take out some of it, and then it does really well in staying away.
It hurts. It really hurts. If I do any weightlifting, I get on a bike, I do a bike race, it really, at the end of the day, my legs are so sore.
All right, well, heck, let's get you back there. Okay, what we're going to do first is take care of the greater saphenous veins on both of your legs. Those are the ones that are really started the whole problem and caused the varicose veins. We're using radio frequency to treat your vein, which is basically we're going to heat the inside of the vein so that it destroys the vein itself. There's going to be a stick and a burn right now. And then over time you just kind of reabsorb the vein. But that takes off the pressure from those superficial veins because you lost the valves in it. And that high blood pressure you have inside this greater saphenous vein pushed out and created those varicose veins. Besides, we got to get these legs in good shape so you can take over Lance Armstrong's place without the steroids.
Dr. Nesbitt is awesome. It was funny because we started talking about the procedure, and really all we talked about was, he does these ultra marathons and he races in the jungles down in South America, and he gets it because he lives the lifestyle that I do too. And that really helped put my mind at ease. It's like, okay, he understands.
Okay, now we're just threading the catheter into your leg. It's a little bit obnoxious, but not terrible. It's essentially a fancy way to create a microwave inside the vein. And so we're going to just insert this little device all the way up to the top of the vein. And it's going to treat 6.5 centimeters at a time, where it literally closes off the vein. So the most important thing for you is we need to numb that vein up. And so it's a series of little needle pokes. And on the ultrasound screen, you can see the fluid going around where the vein is. And that fluid compresses the vein against the RF device and numbs up your vein. We entered just below your knee, and we're actually treating all the way up by the groin down to the knee.
My wife is definitely concerned, which I think is funny. She just, she doesn't understand why, if it's necessary or not. I don't think she understands the pain. She thinks maybe I'm being egotistical or whatnot, but is incredibly supportive.
So we're going to take care of the vein right now, but if you start to feel anything, just say stop, and we can stop it immediately. But most likely you won't feel anything. As you hear the clicking, what we're doing is we're burning 6.5 centimeters of the vein, and it heats it almost right away to about 250 degrees Fahrenheit, and that destroys the interior of the vein and closes the vein off, which then solves the problem.
I feel 10 years younger than I am, and I don't want to lose that feeling. And I'm very active and want to continue to be active. And so my concern is if I don't address these veins in my legs, not only am I going to be self-conscious of how they look, but can I continue to do the things I'm passionate about?
Okay, Curt, now we just got to get you on the other side. So first we put in a needle and then a guide wire, and now we're going to take out the needle and introduce the catheter. And then we can follow that with the RF device. Okay, now we've just got to do those series of needle pokes again to numb up this vein and compress it. By being able to do this under local instead of general anesthetic and stuff, it makes it so you recover a lot quicker and you can actually go back to work the same day that you have it done.
I don't expect much of a time to recover. As a matter of fact, tomorrow I've got lots planned. I got things planned tonight.
Then we make an incision that's 1 to 2 millimeters, and it's really kind of cool because you don't need to have a stitch put in or anything, and they heal very well, so that for the most part you usually can't even see where the incision was. So what we're doing right now is we're finding the vein and then pulling it up, and you take out part of the vein. Sometimes you get a fairly long segment, sometimes you get just a smaller part. The key to that is you've got to interrupt the vein so that it no longer is functional. And so you take out substantially most of the vein, and the rest of it you make it so it's not functional. And in doing that, it removes the vein. And then the symptoms. And it's truly amazing that you can actually get rid of the vein like that. Yeah, what's going on over here? Okay, that was a good one. I think that's the last one.
When you talk about varicose veins, you think of the Golden Girls, right? It's like, oh, well, this is what old ladies have and everything. You know, varicose veins can affect men, can affect women. You know, it's not specific to gender. And, you know, if the surgery is maybe thought of by society as being for women, so what? My legs are going to feel amazing tomorrow, and I'm going to be better than ever.
We're wrapping your leg up, and you can just leave these on tonight. You'll find them to be fairly comfortable. If they get uncomfortable, you can take them off, but it kind of holds pressure for you against those veins that we took them out. Essentially, we're doing the same thing to both sides. This dressing right here, you can take off in 2 hours. It's tighter, and it's holding pressure against where we took out those varicose veins to keep you from getting a worse bruise. And then we just want you back to regular activity level, you know, tonight and tomorrow and stuff.
We'll be right back to talk with both Curt and Dr. Nesbitt about the procedure and hear how Curt's life has improved after having his veins removed. Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation.
Be sure to check out the Younger You website to watch full episodes of the show, stay up to date on the Younger You challenge, and get useful tips and tricks to help you achieve the Younger You.
Before the break, Curt had his varicose veins treated. I sat with he and Dr. Nesbitt to talk about the procedure and what Curt can expect after having it done. Dr. Nesbitt, you've done a couple of procedures on Curt. Why?
Well, when Curt first came in, he had pretty significant bad varicose veins and venous insufficiency underneath. So in order to get him back closer to normal, he had to have a couple of procedures to take care of the symptoms and problems.
Okay, so let's be honest, Curt. Why? Why did you want this done?
You know, obviously the health reasons behind it. I would run and I'd have achy legs, restless leg syndrome, things like that. But if we're going to be honest, a lot of it was vanity.
Okay.
I work hard to, you know, get my legs defined, lift weights, go running, and when you've got the first thing people notice is this ugly purple line going down the back of your leg, puffing out. That just was...
Well, I agree.
Yeah.
There's nothing worse.
Exactly.
And it is a vanity thing for you, but the underlying occurrence, Curt, is, let's be real, there was a health issue.
Absolutely.
You know, and I think that's the most important thing to think about. Now, you are a guy that likes to cycle and run, so you are wearing shorts,
yes,
obviously. So there's the vanity part that comes in. What did your buddies say, and your wife, when you said you wanted to have this done?
You know, I think there's a lot of misunderstanding of what this procedure is.
Yeah.
You know, there's some archaic surgeries from 10, 20 years ago. And so people have this, you know, this impression I was going to be completely knocked out. They're going to open my legs open and rip them out. And it really wasn't like that at all.
Okay.
So there was some fear, I think, that they had.
All right. So when you explain the pain of the veins with the issue, explain what it felt like for everyone at home.
It wasn't pain as much as it was discomfort.
Okay.
You know, because there's lidocaine, there's local anesthesia, so you don't really feel the pain of them being pulled out. But what you feel is, it's like peeling a scab.
Yeah.
You're aware that there's a piece of your body that is being removed.
Okay.
And it's just a really uncanny feeling.
So were you taking any pain medication before you decided to have this operation for your veins because they were throbbing?
You know, I quit lifting legs. I quit, you know, doing squats and doing lunges because it was just too much pressure on my legs. But when I would go for a long run, my legs would just ache, especially right, you know, behind the knee. The veins kind of came out underneath the knee, and it hurt so bad I'd have to take ibuprofen to help with the swelling. And so, yeah, every time I was active, which is pretty regularly, I was having to pop some ibuprofen.
Well, Dr. Nesbitt, just hearing that, I think to myself, why would you do exercise if you know it's going to hurt?
That's the thing that's so subtle about venous disease. A lot of people think it's just cosmetic, and in fact, at first it can be, but the disease gets worse as time goes on. And because it hurts and it affects your exercise intolerance, you're less inclined to exercise. Less inclined to exercise makes you less healthy, so on, so forth.
And it will just get worse and worse and worse.
Exactly.
Basically.
It's just something over time that definitely worsens.
Will Curt's varicose veins come back? Not the ones that you just removed, but will he have issues from other ones?
He'll never have anywhere near the trouble he had before.
Okay.
And he may not ever get the varicose veins back because he had the main contributors to them treated. However, some individuals are unlucky enough to develop tributaries that can cause enough pressure to get another varicose vein. But it won't be nearly as severe, and it can always be treated.
I think that gives some people a lot of hope after having the procedure, because people associate having a cosmetic procedure like this done, they don't think about, geez, they won't come back. You will have some sort of reoccurrence at some point.
Correct, because fundamentally it's a genetic disease and he's got the problem.
Well, that's what I wanted to say to you. Being a genetic disease, what other members in your family have such serious veins like you did have?
Quite a few of them. I come from a family of very large people, and so I think, you know, with the extra weight, you know, there's more pressure on the legs, and so I know a lot of my siblings and my parents, my father, my grandmother have had it, so.
So this has been a great success, which we really love. But I want everyone at home to look at these next steps that Curt had to take to have full recovery.
The first thing patients need to do is get up and walk for at least 20 minutes every few hours. Also, avoid sitting with your legs hanging or standing in one place for long periods of time. This is key to maintaining proper blood flow. Make sure you don't swim or take a bath for at least 72 hours following your procedure. Soaking your incisions in water can interfere with your healing process. However, short showers are allowed. Don't exercise too vigorously for the first week, especially exercises that utilize the legs. This might slightly increase the risk of your veins reopening after treatment. For the first week, make sure you don't fly. Sitting still during airtime can cause poor circulation and even blood clots. Avoid excessive sun exposure for 2 weeks, as this can make any scars to become darker than the surrounding skin. If you must go outside, you should keep your incision areas covered by clothing. It is also important to make sure you are wearing plenty of sunscreen.
Curt, now you've had this procedure done, are you happy?
Very happy.
Why?
I wish I would have known about this a long time ago. You know, my confidence obviously is a lot higher. I don't have to be afraid to wear shorts. You know, I can go out.
So you're wearing shorts 24/7?
No, yeah, exactly. This warm weather, absolutely. You know, the other thing is I actually completed a triathlon this last weekend, and I didn't have any leg ache whatsoever as soon as I was done. You know, I did this a year ago. I did another triathlon. I went home. I had to take an ice bath. I had my legs, I had my legs elevated. There was so much swelling where the veins were. And keep in mind, my surgery went from here, you know, all the way down to my ankles. It was the full length of the leg, both legs.
You know, we saw your groin.
Yeah, well, you're welcome for that, America. And so it was so nice to go do this race, and then in the afternoon, I'm just kind of popping around, going to the store. And
did you think before the procedure, when you did your last marathon, did you think the pain was because of the veins or that you were unfit?
You know, I didn't quite realize the effect that the veins had.
Yeah.
I always knew that they contributed, but I had no idea. It's been night and day.
Yeah. Curt, for all the blokes that are sitting out there that have just watched you having this done, what do you say to them?
Man up, just get it done. It's not a female procedure. It's not for women. It's for both men and women. I'm healthier, I'm happier, why not?
Yeah. Dr. Nesbitt, what's the ratio between men and women actually having this procedure done?
It should be around 40% male, 60% female, but it's probably closer to 10% male, 90% female.
Is it because men just live with it?
They're not aware that it's causing them problems. They're not as much worried about the cosmetics, so they don't go out and get it checked out.
Ah, got you. It's just vain people like Curt, is that what you're telling me?
Yeah. Things like restless legs you'd never associate to be with your vein.
Well, that's what Curt was saying. You would never have thought, because he was running, that he associated the pain and the throbbing because of the veins.
Correct. And
So
that's the deceptive thing about it.
I think anyone sitting at home now, who have those problems, and now can associate that back to the veins when they finish their run, as Curt does. Hey, Curt, thank you so much for showing everyone the procedure, and we really appreciate, Dr. Nesbitt, you doing it for us.
Thanks, Trey.
As we learned today, varicose veins can cause a lot of discomfort for both men and women and keep you from doing the things you love. Getting rid of those unattractive veins with today's fast and effective methods can improve your life and maybe even help you feel a little younger. For more information about Dr. Nesbitt and varicose vein treatment, or to learn about the show, please head over to our website at theyoungeryou.tv, and I'll see you next week.
Next week on The Younger You, we'll be giving Tara a makeover with the help from Marinello Schools of Beauty. The Younger You set provided by Madison McCord Interiors.